Although as a practice we had been doing some social prescribing, it wasn't streamlined. There were no specific slots on anybody's appointments where doctors could send patients that they felt would benefit from social prescribing. I was very lucky to be offered a place on our Royal College of Nursing leadership course up in Bristol. It was a 2-day course, and it was for nurses who were interested in change or who had innovative ideas. And there was opportunity on completion of the course to come up with a project, write a business plan, and then submit that to NHSE, and then they would offer you funding if they thought that your project had potential. So on completion of the course that I went on, I wrote the business plan all around a different model for general practice, and it was nurse-led social prescribing. It's a way to enable healthcare professionals such as doctors and nurses, a means to direct patients to lots of schemes from gardening, artwork, there's tea dances. The variety is enormous. Getting the right thing for the right person is what counts. Recognising that people's health depends on other factors such as social, economic and environmental. Making sure that we take all of these factors into consideration is key, because what we're hoping to do with social prescribing is encourage patients to take more ownership for their own health and well-being. Lots of patients who would benefit from social prescribing tend to have quite complex needs, and quite often their motivation is quite low. So this requires quite a lot of input from the healthcare professionals. Social prescribing, to be successful, has to allow lots of time so that the person who's working with that patient has time to make sure that whatever we come up with is personalised. It's really important that these patients are followed up regularly, because quite often people are given a leaflet. Leaflets do not work. There needs to be a build-up of trust. They can be seen every week if they want to for at least 30 minutes. It's always challenging to do something new, and you don't know what you don't know. So we wanted to do as much groundwork as possible. However, lots of patients like what's familiar. They're not very good, some of them, at just going somewhere different, and quite often they just won't go. So we wanted to start with some safe social prescribing. The healthcare assistant and I, we did lots of local research. We identified some training needs to make sure that we really understood what it was we were trying to do. We set some goals to see what we're trying to achieve, how we would measure them. That's very, very difficult. Once we'd identified some training, we resourced that, and now we're at the place where we're up and running. In Devon, there is as yet no clear plan on how social prescribing will be implemented across the county. This gives general practice nurses a real chance to have an opportunity to influence how this service will be developed. Our healthcare assistants 1 day a week now is almost at capacity. We're looking to see if we can make that into 2 days. The GPs have fed back really positively. We haven't had any patients not coming back. It is early days, as I said, so there will be a few blips along the way, but so far so good.